Campylobacter infection, also referred to as campylobacteriosis, is a bacterial illness caused primarily by species of the genus Campylobacter. It is one of the most common bacterial causes of foodborne illness worldwide, with Campylobacter jejuni and Campylobacter coli being the predominant species responsible for infections in humans. The disease primarily affects the gastrointestinal system, leading to symptoms like diarrhea, abdominal pain, and fever. Transmission. Campylobacter bacteria are zoonotic, meaning they are transmitted from animals to humans. Common sources of infection include contaminated food and water. The most common mode of transmission is the consumption of undercooked or raw poultry. Cross-contamination during food preparation, such as cutting raw chicken and using the same utensils for vegetables, can spread the bacteria. Unpasteurized milk and untreated water are also significant sources. Direct contact with animals. Contact with infected animals, especially livestock and domestic pets, can transmit Campylobacter. Young animals like puppies and kittens often carry the bacteria without showing symptoms. Person-to-person transmission. Although less common, the infection can spread from person to person via the fecal-oral route, particularly in settings with poor hygiene. Environmental exposure. Swimming in or drinking contaminated water, especially from recreational sources, is another risk factor. Symptoms. Symptoms of campylobacteriosis typically appear 2 to 5 days after exposure to the bacteria, with the incubation period ranging from 1 to 10 days. The primary clinical manifestations include diarrhea. This is often watery and can sometimes contain blood or mucus. Abdominal pain. Cramping is severe in many cases and is a hallmark of the infection. Fever. Moderate to high fever accompanies other symptoms. Nausea and vomiting. These are common but less prominent than diarrhea and abdominal pain. General malaise, fatigue and weakness often accompany the infection. The illness usually lasts about 3 to 7 days, though symptoms can persist longer in severe cases or immunocompromised individuals. Complications. While most individuals recover fully without long-term consequences, complications can arise, particularly in vulnerable populations. Dehydration. Severe diarrhea can lead to significant fluid loss, requiring medical intervention, especially in children and the elderly. Guillain-Barré syndrome, GBS, a rare but serious complication. GBS is an autoimmune condition where the immune system attacks the peripheral nerves. It is associated with Campylobacter jejuni infections and can lead to muscle weakness and paralysis. Reactive arthritis. This condition, characterized by joint pain and inflammation, may occur weeks after the initial infection. Bacteremia. In rare cases, especially in immunocompromised individuals, Campylobacter can enter the bloodstream, causing a systemic infection. Irritable bowel syndrome, IBS. Post-infectious IBS may develop in some individuals following a severe gastrointestinal infection. Diagnosis. Diagnosis of campylobacteriosis typically involves stool culture. This is the most common diagnostic method. A sample of the patient's stool is tested for the presence of Campylobacter bacteria. Molecular testing, polymerase chain reaction, PCR, assays are increasingly used for faster and more accurate detection. Blood tests. In cases of suspected bacteremia, blood cultures may be performed. Treatment. For most people, campylobacteriosis is self-limiting and resolves without treatment. Supportive care is the mainstay, including hydration. Oral rehydration solutions are crucial for preventing dehydration. Intravenous fluids may be required in severe cases. Antibiotics. In severe cases or when symptoms persist, antibiotics like azithromycin or ciprofloxacin may be prescribed. However, resistance to antibiotics is an increasing concern. Probiotics. Some evidence suggests that probiotics may help restore gut flora and alleviate symptoms, although their effectiveness is variable. Prevention. Preventing Campylobacter infection involves a combination of food safety practices, personal hygiene, and environmental precautions. Proper food handling. Cook poultry and meat to the recommended internal temperatures. Avoid cross-contamination by using separate cutting boards and utensils for raw and cooked foods. Hand hygiene. Wash hands thoroughly with soap and water after handling raw meat, caring for animals, or using the restroom. Safe drinking water. Consume treated or bottled water, especially in areas where water contamination is common. Avoid raw dairy. Do not consume unpasteurized milk or products made from it. Travel precautions. In regions with poor sanitation, avoid raw or undercooked foods and untreated water. Global impact. Campylobacteriosis is a significant public health concern, causing millions of illnesses annually. According to the World Health Organization, WHO, it is one of the most common bacterial causes of diarrheal disease worldwide. The burden is particularly high in low and middle-income countries due to inadequate food safety measures and limited access to clean water. Improved surveillance, education, and antimicrobial stewardship are essential for controlling the spread and mitigating the impact of Campylobacter infections. Conclusion. Campylobacter infection is a prevalent and potentially severe bacterial illness that primarily affects the gastrointestinal system. While most cases resolve without treatment, complications can occur, highlighting the importance of preventive measures like food safety, hygiene, and clean water access. Awareness and proper management are key to reducing the burden of this disease globally.